A while ago, I was consulted for a patient who was going through some rough chemo-related nausea and vomiting. As I was reviewing their medications, I noticed that their oncologist had prescribed them olanzapine, also known as Zyprexa. So I asked them, oh, the Zyprexa didn't help? Because usually that's a pretty good drug for chemo-related nausea and vomiting. The patient kind of looks down and says, well, I didn't actually take it. Why not? I asked. Well, I was looking it up and I saw that it's prescribed for other stuff. And right away I knew where this was going. If you Google olanzapine, right away you're gonna see that it's commonly prescribed to treat schizophrenia, which can be a bit of a shock if you've just been prescribed the exact same medication for nausea. So why on earth would the same drug be prescribed for both schizophrenia and nausea? What's the link? Dopamine. Dopamine is a busy little neurotransmitter. You might be familiar with dopamine for its role in the brain's reward pathways, but it's also one of the main neurotransmitters involved in telling your brain that you feel nauseated. So a lot of anti-nausea medications are designed to block the transmission of dopamine to stop that queasy feeling. Meanwhile, too much dopamine has been tied to some of the symptoms that are associated with schizophrenia, which is why so many antipsychotic medications are also designed to block the transmission of dopamine. So that's why you'll often see overlap in drugs prescribed for nausea and drugs prescribed for psychiatric conditions.